I was diagnosed with colon cancer. My colon cancer spread to other parts of the body. I was taken by Anu to Dr. Sachin. My name is Joe Kamau. I come from Kenya in East Africa. About towards the end of December, I was diagnosed with colon cancer. Once I was diagnosed with colon cancer, I made a decision to consult my family oncologist, and she ordered for a PET scan. The PET scan was done in Nairobi. My colon cancer is localized or has actually spread to other parts of the body. So on the 10th of January, I started my journey from Nairobi to Hyderabad, heading to Yashoda hospital. And immediately on arrival, I was taken by Anu to Dr. Sachin. All my organs were tested. 24th of January, I went into the theater. Well, the moment I opened my eyes next, and Dr. Sachin told me, Mr. Joseph, your operation is successful. And after that, I stayed in the ICU for one night, and I started recovering in the room, and indeed 5 days later, I was discharged. The post-operation treatment and care I have received very, very supportive indeed. I want to thank, going all the way from the nurses, looked after me extremely well, going all the way, even including the cleaners, the people who used to take me out for walking practices, and then of course Dr. Sachin and his team. I'm 100% cancer free, and therefore today as I sit here, I'm on my way out back to Kenya. So I wish Yashoda hospitals great success and meteoric growth both in India as well as beyond India. Thank you.
Hello friends, I'm Dr. Sachin Marda, Senior Surgical Oncologist and Robotic Surgeon, Clinical Director from Yashoda Hospital, Somajiguda. One more inspiring story from us. Meet our patient Mr. Joseph, who is 76-year-old, maybe not old but still young I can say. He lives in Nairobi, Kenya, and he had some issue in his intestine, and then he consulted to a local doctor and then an oncologist there, and after evaluation there they found that there is a tumor which needed very complex surgery, and being a patient 76-year-old with some cardiac issues, they wanted the excellent treatment, and that's why she referred to us. And once we received the patient, we evaluated everything, and definitely he would require surgery because there were polyps and one tumor into the colon. So he would require extended right colectomy with ileocolic anastomosis along with node. That is a surgical treatment we planned, and we did this surgery with robotic technology, and believe me, the surgery was scarless. There was only 2-inch scar from where we excised the specimen, and on 4th day patient discharged, and in 15th day he was back in his country. So that was the technology advantage which we have for elderly people. Especially when we consulted him before surgery for the cardiologist for fitness, he found 2 coronary artery blocks, but with that risk and given the patient consent and with that good technology and expertise, we could do this surgery and patient went back very happily. One more thing here I want to tell about Joseph. He is very senior person in Nairobi. He is very physically active. His mind power and his attitude towards life is exemplary, very enthusiastic person, and that has helped him to recover from the cancer. Also, I want to tell, we have launched Cancer Warrior Support Group, and he has become the active person to propagate the knowledge and the awareness about the cancer not only in India but also in our own country in Nairobi. So thank you, Joseph, for this wonderful initiative. And the lesson from this all small video is, yes, cancers are becoming common. Even elderly people, even chronic heart condition, and with the high risk condition of the patient, with the technology advantage and with the expertise of robotic surgery, we can do complex surgeries without much hassles. And not the least is positive mindset of the patient is very, very important. So together we can win our cancer. Thank you.